March will mark 2 years since the start of the pandemic and the third spring semester that students have had to navigate learning through COVID. The greatest changes came during the spring of 2020 when students spent 9 weeks out of the classroom, creating some significant learning loss when they returned in the fall. In tonight's Eye on KELOLAND, Bridget Bennett looks at how area students are catching up after COVID.
Is this leukocyte lab activity.
Like many South Dakota schools, the Harrisburg School District returned to in-person instruction in the fall of 2020. But the district has kept a close eye on how the pandemic is impacting its learners.
We've developed a way of looking at COVID learning loss gaps and then monitoring that gap closure over time.
Harrisburg is collaborating with researchers at Augustana University to study and track learning loss tied to COVID.
So looking at ways to push aside all other variables, things that might be impacting learning that occur during a regular time in history, and focusing specifically on what happened while kids were out of school distance learning 2 years ago, and then how dealing with COVID since that time has impacted their learning.
Michael Amelins, Harrisburg's Director of Instruction and Federal Programs, says their study found the greatest gaps came in math and science.
You have to write the inequalities.
If you look at our general student population, we saw about a 20% learning loss due to COVID in the area of reading and about a 60% loss in math. And what that tells us is that in general, parental support at home was much stronger in areas such as reading.
And parent support plays a big factor overall.
Students who are economically disadvantaged and those that are English learners, so English isn't their primary language, those were the two groups that seem to be hit the hardest.
Over the past year and a half, the Harrisburg School District has used money from the American Recovery Fund to intentionally add new supports for those students.
We hired a new social worker to broaden our footprint there and make sure we're providing supports. We've hired additional intervention staff, so staff who work with our struggling readers, struggling math, English learners.
The district has also added monthly early release days to its calendar, giving teachers more time to address the individual needs of students.
Work on personalized intervention plans for students, understanding that everybody's experience is a little bit different. We're trying to evaluate learning loss that results specifically from COVID. We're not just looking at the academics, we're looking at the whole child. And so it's important to look at any social development, social emotional supports. They experience trauma during distance learning, during this entire COVID experience. Things have been very unusual. They've been out of their routine.
That routine continues to be impacted even 2 years into the pandemic.
The most noticeable issue we've had is just inconsistency. You know, students might be quarantined for a while. They might have to, they might elect to distance learn based on health concerns. And so it's just inconsistency in learning and in their routine that's causing the greatest impact.
Amelin says those social and emotional factors drastically impact students' academic success.
When we develop strategies as a district, we're not just looking at training academically, but also how we can support students, because what we found is that if students are comfortable, if they're taken care of, if their needs are being met, then the academics come along with that naturally.
Looking at academic data from the district, those interventions seem to be working.
Our current numbers would project that we've seen about a 90% closure of that learning loss in reading and about 75% in math.
While the Sioux Falls School District isn't actively researching the impact of COVID on learners,
when we think about impacts from anything, it's hard to pinpoint. Is it from that? Is it from a death in the family? Is it a different illness? Is it a family crisis? So I don't think you can pinpoint it and say it's an impact of COVID.
Sioux Falls Assistant Superintendent for Academic Achievement says the spring of 2020 has become a new starting point for tracking academic progress.
And when we did our South Dakota assessment last spring, that's a new baseline. And so when we look at that, we just are moving forward from that baseline and we're making growth.
And after a year and a half back in the classroom, students' most recent test scores are showing quite a bit of improvement.
Last year, very strong. We had the highest graduation rate that we've had in the last 6 years.
Elementary and middle school students also seem to recover on their MAP assessments.
Our students scored above where they did last year for the winter of 20. So the winter of 21, you know, this last Christmas, they're higher than they were last year. and they're higher than they were in the winter of 2019, prior to when we went out for COVID.
Boyson credits that academic progress to the interventions the school district added early on in the pandemic.
At elementary last year, we had our summer programming or summer academy, and we expanded that. We finished in the elementary level, so all buildings have reading interventions by a reading specialist, which we didn't have that before.
But along with these additional programs,
So it just goes by the name, right?
both school districts agree students are able to catch up thanks to the dedication of Keloland teachers.
They were resilient. They moved forward, you know, when we had kids out because of illness or quarantine, and they were teaching on multiple platforms to make sure every child had what they needed.
Dividing decimals.
Our staff are really the success story here in terms of why our kids have been able to close the gap the way they have.
With Eye on Keloland, I'm Bridget Bennett.
The Harrisburg School District expects teachers and students will be dealing with the impact of COVID for years to come, especially young elementary students whose entire school experience has been during the pandemic.